Well, hello and welcome to Healthline. I'm Jennifer Blomquist. I have the privilege of hosting this program, which we are doing live in our studio right now. It's a wonderful show. If you're a new viewer, you will definitely learn something. And if you're a returning viewer, you know the drill. We keep the phone lines open. That's why there's a phone number listed at the bottom of the screen. Since we are live and we have a live guest with us to answer any of your questions, we encourage any calls about the topic. And tonight we're talking about sleep medicine and talking about disorders and advances in technology to try and treat these disorders, all sorts of really interesting things. And I'm sure at least some of you out there have had some sleepless nights or sleep issues or know somebody who has. So feel free to call. Anything along the topic of sleep medicine is more than welcomed. I want to remind you, you have two options if you're going to ask a question. My favorite way to do it is you call in, and that way you can talk to our doctor, who's our guest here, and he may have some questions for you that would help him to better answer your question. So if you're brave enough, and really it's fine, we don't just throw you on the air. They take good care of you on the phone lines. Call and ask your question. You can interact with the doctor live, or if you really don't want to do that, that's perfectly fine. Just talk to the call screener, and she will take your question, and then I can ask it for you. So let's go ahead and meet our guest tonight. He's been here a couple times before. I've never had the privilege of working on a program with him. Mark Evans did, but it's been a few years. It's Dr. Verma, and you are a sleep medicine specialist.
Yep.
Well, certainly appreciate you coming back.
Yeah, thank you for having me.
As I said at the top of the show, I think people probably know some of the basic sleep disorders, and maybe they've even had issues with them. And I don't know if you want to kind of go through some of the primary ones, like sleep apnea, narcolepsy. Sleep apnea, I see all kinds of commercials and things now, you know, because that requires using that machine. So I hear a lot about that. How do you know if you have sleep apnea?
Yeah, so people have symptoms like they are snoring very loud, and when they are sleeping, they are waking up so many times. They wake up with headache. In the night, they have to go many times to bathroom. And when they come back, then sometimes they have difficulty falling asleep again. And they are not feeling rested during the day. They are feeling sleepy during the day. And they are also having a lot of health conditions like high blood pressure, diabetes, migraine, depression, anxiety, and a lot of heart issues.
All right. So if you're having anything like that, probably should go maybe start with your family doctor and see if they think it warrants a visit with a specialist. Another one I think a lot of people have heard of is narcolepsy. Yeah, so narcolepsy is a neurological illness. So in that, the brain keeps waking up so many times during the night, even though oxygen is running good. But for them, when we read sleep studies, so we see a lot of arousals coming up. So the quality of sleep is not good, and they feel very sleepy during the day. And sometimes when they are laughing or they are excited, they lose tone of the muscles, and sometimes they buckle down. So, and sometimes they get sleep paralysis, and sometimes they get hallucinations also when they wake up or going into sleep. So, and that can be very debilitating. I don't even know if they would allow someone with narcolepsy to drive. I don't think you're.
So with proper treatment, they are able to drive. They are able to function their work. Sometimes they need some accommodation, taking a nap, short nap during the work. Otherwise, there are some newer medications and a lot of options nowadays. So they get better. They are not completely normal, but they get better to the extent that they can function just like other people.
Good to know. Yeah. We're going to be talking about some of the treatments for each of these coming up. We just wanted to highlight some of the main ones. Another one, I'm sure everybody, and a lot of people joke about this one, insomnia.
Yeah. So
but it's no joke, really.
Yeah, it is no joke. A lot of people suffering from that things, and they have difficulty falling asleep. They take more than half hour to fall asleep. They keep waking up at least three times in the night, or more than 3 nights per week, and for at least 3 months. So we call it chronic insomnia. Sometimes some family events happen or something happens that is called acute insomnia. So, and a lot of people who have sleep apnea, they also present like insomnia. So they are waking up because of low oxygen and brain is waking up, and they think like they have insomnia. but maybe they might be having underlying sleep apnea too, presenting like that. So
Yeah,
yeah,
definitely warrants getting it checked out.
Mm-hmm.
Another one, I don't know if you want to talk about hypersomnia. I had not heard of that before.
Yeah, so hypersomnia is a broad, definition, like excessive daytime sleepiness. So someone could be having narcolepsy, someone could be having idiopathic hypersomnia when we don't know the cause of it, and someone having underlying sleep apnea. So that can also present like hypersomnia. So in this condition, people are very sleepy during the day. When they are driving, they are falling asleep. When they are doing work, sometimes they are falling asleep. And if they are working with machinery, it is very dangerous for them.
Well, you've kind of alluded to it a little bit, but there are definitely, as you had mentioned, some advances to treat all of these issues.
Yep.
Because I know when I was growing up, it was just kind of like, oh, you count sheep or, watch TV, something, or people used to get those noise machines, like a quote unquote white noise, or a fan. But things have come a long way since then. So what would you say, sleep apnea, would you say that's probably the most common?
Yeah, sleep apnea, is the most common issue. And insomnia is also most common issue in that sense. And they both are not mutually exclusive. Like if someone having sleep apnea, they can present like insomnia, and insomnia can present like sleep apnea. So one by one. So for the sleep apnea, so in the past we had only one option, CPAP, BiPAP machine.
Yeah.
But nowadays there are a lot of advancement in machine also and mask also. So they are more comfortable now, and there are settings we can adjust and make it better. And there are some newer options like Inspire therapy. So that is like a pacemaker. So a small device getting implanted under the skin, and it keep giving signal to a tongue to move forward with every breath. So that is a very good device. And those people who have difficulty with CPAP, they can get benefit from it. They have certain criteria to meet, but they do better on that too. So.
And what kind of test, like if somebody thinks they have sleep apnea, or if you're just trying to figure out what what the diagnosis is, how do you have to monitor people as they sleep? Yeah,
so we monitor. So gold standard is to do sleep study into the sleep lab, but nowadays a lot of insurance required to do home sleep study first, and we have came a long way. Nowadays home test is also sophisticated. So we can do home test most of the time. So, and with that we get information whether someone is having sleep apnea or not. Home test could be falsely negative in 10 to maybe 20% of cases. So in that case, we repeat test and possibly in lab test. So.
I was going to say, I would think people in general would feel more comfortable doing the home test.
Yep,
I know I would.
They do. So
maybe does that give you maybe a more accurate?
Yeah. So they are
diagnosis?
Sleeping in their home environment. They are they are familiar and they do their activities.
Yeah.
They can sleep on their sleep timing, not not the sleep lab timing.
Yeah.
So if someone is sleeping late and waking up late, they have flexibility. So that is good in that sense.
All right.
Yeah.
Let's touch on some of the other, disorders. Insomnia. Again, is that something you can diagnose by, monitoring sleep?
Yeah. So insomnia, we can mainly we ask questions. So it is clinical history, but we also do sleep study to find out if they are having underlying other sleep disorders. Underlying other sleep disorders could be sleep apnea, that is most common, but sometimes people have a periodic leg movement disorder. So they are moving their legs a lot, and because of that, they are keep waking up, or they are having some other medical issues that can also lead to insomnia. Sometimes they are having very too much pain going on, so they keep waking up because of that. There are some other environmental issues they are not feeling safe, or there are some sounds going on, so they keep waking up because of that, or having caregiver responsibilities. So a lot of things can cause insomnia.
I was going to say, as a parent, I just, once I became a parent, I just felt like I couldn't turn it off. You know what I mean?
Yeah.
And you have that worry factor. And even now, my children are older, but I still, at night, I will wake up at the drop of a pin. I think a lot of parents are that way.
I have felt the same way. So
it's not really a disorder.
Yeah, it is not disorder. It is just like you are a parent and you are taking care of kids. So.
Yeah, all right. My husband doesn't have that issue. He just sleeps away. Well, I do all the worrying, I guess.
Yeah, so it happens, yeah. So.
Now, narcolepsy, is that something that would be genetic or hereditary? I mean, could you just be predispositioned to having that?
Yeah,
or?
so some, there are some genetic factor also that predispose to narcolepsy. There are certain genes, DBQ0602. So those people are more prone to have narcolepsy. Not every person with that gene present like narcolepsy, but if certain trigger happen, sometime viral infection or anything triggers, then they have tendency to go to present like narcolepsy. So I reported a case that she had a genetic predisposition, and after she got some infection, viral infection or sometime vaccination, and then she developed narcolepsy.
Okay, that's interesting.
Yeah, she's doing good on the treatment. So,
I was wondering, I mean, do any of these issues that we're talking about happen to children? I mean, because some children just don't sleep. I mean, when they're babies, that first year of life, the sleep can be pretty erratic.
Yeah.
And usually as they get to be toddlers, it's a little more stable. But have you ever had to would it be even something you'd look at for like a younger child?
Yeah, so a younger child, currently I'm doing adult patients, so, but younger child can also present that way, but we send to pediatric sleep medicine for that. So.
Okay.
Yeah.
All right. And then I just wanted to touch on, we have somebody who wants me to ask you a question, but we'll just quickly cover hypersomnia.
Yeah.
So is that just like an extreme case of insomnia?
So hypersomnia is sort of opposite of insomnia in a way, people feel more sleepy, and when they do certain activities drive or work or something, they feel very sleepy. So that we call hypersomnia. But we have to find out what is underlying cause behind it. Is it untreated sleep apnea or untreated insomnia that can, if they are not sleeping during the night and waking up, they can present like hypersomnia during the day, or narcolepsy, or sometimes idiopathic hypersomnia, or they are having underlying leg movement disorder. So all these things can present a symptom like hypersomnia. So we have to look underlying cause, and there are medications we can after treating the underlying cause, if they are still sleepy, then we can put on some medication, and that helps them.
And I know you've referenced for all of these issues, there are medications. We did get a call from a gentleman named John. He wanted me to ask you if there were any non-habit forming sleep medications, because I think that's a big concern for people too. They don't want to be dependent on it, and I completely sympathize with that.
Yeah.
Are there different options, or even things that are more natural, like herbal or?
Yeah, so there are some non-habit forming, like melatonin is natural hormone, and there are some medication also for insomnia. They are not habit forming, and if we stop them, people are okay to stop them. But there are lot of medication for insomnia. They could be habit forming, and I would recommend to talk to your doctor, and based on different medication, we can advise you how to come off from that, or which one is optimal medication for you.
When you mentioned the melatonin, I mean, you can see 20 different brands of that at the store. I would just, if you want to reiterate the importance of just maybe not just going out there and getting it, because that's not, a lot of those types of things, they're not regulated by the FDA.
Yeah, they are not regulated by FDA, yeah. So the strength could be different in different formulation.
Yeah.
So I would suggest to talk to your doctor and see which one is better, whether you need that or you don't need that, or you need further assessment of underlying sleep disorder that might be causing you those problems. And if you fix that, maybe insomnia get better. So.
All right. I do hope so. A good night's sleep is invaluable.
Yeah.
I want to thank John, was the name of the man who called in that question. And thank you so much for that, John. And just want to remind all of you watching, that's why we keep that phone number at the bottom of the screen, so you can ask a question if you would like.
Yeah.
You can do it the way John did, where I just asked the question for him. Or Dr. Verma's a very nice person. He'd be more than happy to talk to you live if you would like to ask the question live. So feel free to give us a holler anytime. In the meantime, we're going to continue to talk about sleep medicine. One thing you had touched on in the notes you sent to me was something called Inspire Therapy.
Yep.
And I don't know if you want to elaborate on what that is.
Yeah, so Inspire Therapy is hypoglossal nerve stimulation therapy for obstructive sleep apnea. So that is like a pacemaker for sleep apnea. So when people have difficulty tolerating CPAP machine or BiPAP machine, then be like, if they are candidate for Inspire Therapy, then like I refer them for Inspire Therapy. So that giving signal to the tongue to move forward in the night with every breath, and we have to adjust the setting after it is implanted, and we optimize the setting, and it works good.
Is that something that, no matter, regardless of your age, you could be a candidate, or is it
so mainly done in
minimal?
adults? Yeah, mainly done in adults, like age 18 and above. But studies are being done for the pediatric patient also, for certain patients who have Down syndrome and they are not able to use any mask. So there are good results with that too.
An implant would be preferable, sure. I know that doctor would like to talk about AI regarding sleep medicine, but we did have someone else who called in and wanted to ask you a question. He wanted to know if it was common for a family to have two family members with the same sleeping disorder.
Yeah, so yes, that's a very good question.
Like immediate family members?
Yeah, so immediate family. So if someone has sleep apnea, so it is more common. And if someone has insomnia, that could be common. Narcolepsy could be common in the family. So yes, they could be common because of, suppose someone has sleep apnea, so they inherit the same morphology from the parents. If their air passage is narrow and they are snoring, maybe they have sleep apnea. So,
you know, and we usually, when we're getting into the fall months, you know, we're starting to talk about holidays and things like that. And you're talking about family members having issues.
Yep.
We've had some doctors come on in the past, and they're like, "Hey, you know, with Thanksgiving not too far, it's not that far away. Think about making sure other people in your family know when you get diagnosed with something.
Yep.
You know, I mean, because some of like you, I didn't even think about sleep disorders being, you know, a genetic or hereditary
so it is
issue.
more common in the family, like,
Okay.
Yeah.
Well, it's always good to know what's
Yeah,
going
one
on.
more thing I wanted to mention about new treatment options. So there is another type of sleep apnea that will be called central sleep apnea. In that, the brain fails to give signal to breathe.
Yeah.
So sometimes for those patients, this CPAP, BiPAP, or there is a advanced treatment called ASB, those things does not work or they are not able to tolerate. So we have new treatment option for them. That is also an implant we call phrenic nerve stimulation therapy, remedy. So that is implanted by cardiologist, and then we manage that situation. So that is also one implantable option for central sleep apnea also.
Yeah, it's amazing to hear all these advances. I had no idea you could do that implant you were talking about, and it's amazing.
Yeah, internal implant, yes.
Yes. So AI is something, we hear about it so much. Again, you and I were talking before the show, and I said, I'm not sure what to think about it. I think there's definitely good, but then there's also some areas where it becomes worrisome. How is it playing a role in sleep medicine, or do you see it playing a role greatly in the future?
Yeah, so I'm very optimistic, and AI playing a huge role in sleep medicine because we accumulate large amount of data, like when we do sleep study in the night, around 8-hour data, home sleep study, again, like, 6 to 8 hour data. So these data, and we gather a lot of physiological data. So AI is helping to predict, like, okay, like, this person is having, like, this apnea going on, oxygen is running low. So AI is helping to be more efficient to read, like, those studies and score those studies. And also the same data and same algorithm A lot of companies are putting into a smartwatch or ring. So they are taking the same concept and putting all the algorithm in that. So that is available to regular consumer. Like people are wearing a smartwatch, ring, and all those things. So that can also give data whether someone is having low oxygen in the night or waking up too frequently. Those are not 100% accurate. They are maybe 60 to 80% accurate. But over the period of multiple nights, they give some idea whether someone is at risk of certain sleep conditions or not. So that way it helps. But for someone who have a lot of anxiety and they are looking those data too much, and because of the anxiety they are not sleeping, so I would recommend not to use for those people. So.
Well, and you have brought some images of the tests, whether you do home testing or sleeping in the lab.
Yeah.
So are you saying if you did a home test, you could be wearing or be hooked up to something that would give all this data to you?
Yeah. So
instead of them having to go to a sleep lab and be gone from their home.
So that is very comfortable, doing the study at home. So this graph you see, this is the WASP home sleep study, and in the middle you see that is showing drop in oxygen.
Yes.
And because of that drop, in different stages of the sleep. So in this image you see, so a lot of sleep apnea going on because of that oxygen is dropping, and this patient is showing that has sleep apnea. So very bad one.
And you know what? It's interesting. I think a lot of people don't realize that they have poor sleep or that they're restless until you have a spouse. Like my husband is in denial. He's still, after 24 years of marriage, in denial that he snores.
Yeah.
He doesn't believe it, but my kids know it and I know it.
Yeah.
And it's just funny. But my mom was the same way. She didn't know that she was snoring until my dad, after they've been married, decades, he said, you're starting to snore a lot, and she had sleep apnea.
Yep.
So sometimes, other people in the household, I would think would help you.
Yeah. But sometimes people don't listen. So I have seen some of spouse, they do video recording and then they show that.
Yeah.
Or someone living alone, and when they are going on vacation, sharing room, and they being told hey, you snore. So but these AI, they can help these people who are living alone, and they can give some idea what is going on with the sleep. So
definitely.
Yeah.
We only have a couple minutes left, but I want to make sure we get in. You had done a talk about quantity versus quality sleep. So I don't know if you want to kind of give your little spiel about that, because I think people would love to hear if it makes a difference.
So I gave a TEDx talk on quantity versus quality sleep. A lot of people have these type of problems. They are not having good quality sleep, or sometimes people are sleeping 7 to 8 hours and they think this is enough, but that is not. So that's why I gave a talk to educate general public to check their quality sleep many years before they develop other health conditions, and by fixing the sleep, they can live longer and healthier.
Yes, I've heard that sometimes if you don't get much sleep for most of your life, or if your sleep is broken up, maybe you get 2 hours here, another, that is
not good.
That it doesn't make up for one full restful night.
Yeah.
What do you recommend for your average healthy adult? How many hours of sleep should we strive to be getting?
So 7 to 9 hours of sleep is considered good.
Okay.
But that should be quality sleep. If they are after 7 to 9 hours of sleep, if they are still feeling sleepy, tired, it means the quality of sleep is not good, so need to be checked.
And what would you say as you get, because I'll hear some people say as they get older, they feel like they need less. Or I know my grandma got to the point where she just couldn't sleep more than 5 or 6 hours. She just, I don't know if that's a disorder, or is that common as you get older?
So that is common. As we age, the requirement of sleep goes down. People sleep less. But whatever they are sleeping, it should be quality sleep.
Okay.
Yeah.
All right. I don't know if we have time to quickly get this one question in. This was a sleeping supplement, gabapentin. Is that
Yeah, so
appropriate?
gabapentin is a medication that we use for certain problems like restless leg or neuropathic pain, or sometimes for insomnia as well. So that helps in certain situations, but it is not over the counter. It is a medication prescribed by doctor, deemed if appropriate.
Okay,
Yeah.
all right. Yeah, I would definitely take Dr. Verma's advice to heart on everything, but especially check with your doctor before starting to take any of these supplements.
Any of these supplements.
Even if they're natural and over the counter, just to play it safe, right?
Yeah.
All right. Well, Dr. Verma, so nice to have you on.
Yeah, thank you for having me.
Appreciate
Yeah,
having
so,
you. And
yeah.
like I said, we always learn so much from our guests. Appreciate that.
Yeah, thank you.
And I hope you have a wonderful rest of the night. I hope you get a good restful night this evening. I'm Jennifer Blomquist. Take care. We'll be back next Tuesday. Mark Evans will be hosting another Healthline. Take care. Have a good rest of your week.
Yeah, thank you.
The preceding program on PBS Fort Wayne was made possible in part by
Momentum, progress, innovation. Parkview Health knows standing still isn't an option. We must learn, grow, excel, and actively work to advance healthcare for our community and beyond. With technologies that improve access to care and teams of specialized providers, we are moving healthcare forward. Right here at Parkview Health.